3,000 COVID-related deaths among healthcare workers in the United States have occurred since the beginning of the coronavirus pandemic. And so this 9-month investigation by over 70 reporters found these horrific details. One of the many reasons is dire PPE shortages, limited COVID tests, sparse tracking of viral spread, layers of flawed policies handed down by healthcare executives and politicians, and lax enforcement by government regulators have contributed to the deaths of more than 2,900 healthcare workers. This number is actually far higher than that reported by the U.S. government, which does not have a comprehensive national count. So we have to rely on journalists to investigate this to give us a more accurate number. And there's a lot of inequality among healthcare workers as well. It really depends on how well these hospitals are funded. Workers at well-funded academic medical centers, hubs of policymaking, clout, and prestigious research, for instance, were largely spared. Those who died tended to work in less prestigious community hospitals, nursing homes, and other health centers in roles where access to critical information was low and patient contact was high. So, John, I mean, I always appreciate your reporting on COVID because you do a really good job in keeping track of the numbers and reminding your audience on a regular basis of how serious this is, how we shouldn't lose focus on how serious this is. And so, yeah, I wanted to get your thoughts on, this new reporting.
Yeah, it's devastating. Like, any way that you slice up the numbers is going to be terrible. But like if you picture, yesterday's death count, which just got updated, so that was 3,379 deaths reported in one day. If you picture all of those people clustered in one group, it is like so horrifying that we've become, I guess, even us who care about this, let alone the ones who don't, been inoculated against the horror of it. But you should be horrified. But when you imagine a crowd that size of just the doctors and nurses, like the frontline healthcare workers that we sort of imply popularly that we really respect and care about, and I'm sure many individual people who aren't in a position of power actually feel that, but those who were in a position to save more of those lives chose not to. They might tweet about how nurses are great or whatever, but they didn't actually care to save their lives. Don't think that that's horrifying. The idea that you could have thousands, we shouldn't have lost thousands no matter what, let alone tens of thousands. The idea that you could do so in one industry, basically, that you could have that number of doctors, or you could have that number of people who work in food processing plants or something like that. I mean, God only knows the number of people who, had to continue working in food service, groceries, those sorts of things during this time. It's just horrendous. Every story like this is a reminder of how unnecessary and needless it is. And when you mash it up against, and I'll only mention this because I don't think that we're playing the video, all the videos that are now being shared on Twitter of like the Republican